Thank you for joining me today. I'd like to spend this time explaining my practice and how it may help your students. I have my contact information at the end of this presentation and would be happy to meet with any families that you think may benefit from my approach. My name is Cynthia Salemy, and I am a certified nutrition specialist with a Master's of Science in Human Nutrition. A certified nutrition specialist has the credentials similar to a registered dietitian, except that the CNS requires a master's degree or higher in nutrition-related coursework. Our focus is also somewhat different in that we provide functional nutrition, and I'll explain what that means in subsequent slides. The service that I provide is scientifically sound, evidence-based functional nutrition for adolescents who are struggling with mental illness to help them optimize their health and improve their overall well-being. These students may be currently under the care of a mental health professional or are looking for a treatment alternative. This service may also be useful for families that are uncomfortable with the concept of traditional therapies. As my mission statement highlights, my objective is to create a supportive, non-judgmental relationship with the adolescent that facilitates the cooperative development and implementation of nutrition and lifestyle therapies. I'm sure you're familiar with the statistics, and I've only highlighted a few of them here. To me, the most startling is that almost half of all adolescents between the ages of 13 and 18 have already experienced a mental disorder, and 1 in 5 will be seriously debilitated by their mental illness. That means missing school, missing work, and missing out on being young. And mental illness affects the whole family. Even more concerning is looking at depression in this age group. Suicide is the third leading cause of death for ages 10 to 14 and the second leading cause of death among individuals aged 15 to 34. The primary course of traditional treatment is medication and talk therapy, but unfortunately these therapies are not always effective. Current treatments for depressive disorders, for example, are estimated to address only 1/3 of disease burden. Major depressive disorder is a chronic disease with high rates of relapse and relatively low rates of remission. This is why it's important to find new, possibly adjunctive, ways to address mental illness and to delay its progression. In addition, many medications have side effects that hinder adherence. While the side effects vary depending on the type of medication, some of the common ones are nausea and vomiting, diarrhea, weight gain, sleeplessness, insomnia, sexual problems. And although some of these are less serious, some of these medications can have very severe side effects, such as a worsening of anxiety or panic attacks and thoughts of or attempts at suicide. Traditional therapies may not be sufficient for every person. So how can nutrition assist in the treatment of mental illness? There are several specific areas where nutrition intersects with mental health, and there's growing evidence that nutrition plays a critical role in maintaining good mental health. The first area is genetics. Food intake, both quantity and quality, can mediate changes in gene expression that affect mental health, neurodevelopmental, and neurodegenerative disorders. This graphic shows that in addition to nutrition, there are numerous other environmental variables that also impact brain health. As a functional nutritionist, I consider all of these variables in evaluating a client and developing a therapeutic plan. Mental illness has also been linked to nutrient deficiencies and food sensitivities. Moderate to severe deficiencies in such nutrients as vitamin D, magnesium, and omega-3 fatty acids, to name a few, have been implicated in the development and progression of various mental illnesses. Poor nutrition contributes to nutrient deficiencies and often accompanies mental illness. Food sensitivities, unlike food allergies, usually have nonspecific symptoms that do not appear immediately upon consumption and can be difficult to associate with a particular food. They can trigger an immune response, however, that interferes with normal brain function. Gut dysbiosis is an imbalance in the intestinal bacterial population. There are 10 times more bacteria in our gut than human cells, and gut bacteria play several critical roles in our bodies. They supply essential nutrients, assist with digestion, promote intestinal barrier integrity, and help regulate immune system homeostasis. A disturbance in the natural balance between good and bad bacteria can result in a compromised immune system and systemic inflammation. Inflammation can also be caused by other factors such as diets high in processed foods and refined sugars, stress, allergens, and toxins. As the quote under inflammation indicates, inflammation plays a role in mood disorders, and there are specific nutritional interventions, in this case omega-3 fatty acids, that can provide anti-inflammatory properties. In some cases, it may not be obvious that there is an external or environmental factor contributing to the development of mental illness. An approach that looks beyond the symptoms and investigates the cause is more likely to uncover hidden toxicities. There are various specialty tests that can be done to gain a better understanding of a client's nutritional status and identify nutrient deficiencies, food sensitivities, dysbiosis, inflammation, and toxicities. There are two guiding principles that dictate my approach to nutritional therapy. First is the recognition that each individual is unique, and intervention should not be a one-size-fits-all approach. For that reason, I offer a client-centered, individualized approach that creates a therapeutic partnership between me and the client. Second is that the starting premise should be that the normal state is a healthy body. When the body is not functioning properly, it's critical to ask why and not simply treat that dysfunction. That's why there's a focus on underlying causes of disease and not symptoms. For example, a person who is suffering from osteoporosis may take anti-inflammatory medication for the swelling. Although that may temporarily shut down the inflammation by blocking the normal physiological process, it doesn't address why the inflammation occurred in the first place. The functional medicine approach looks at the underlying causes of inflammation, such as poor diet, infections, allergens, stress, etc., and formulates a plan that addresses them and offers scientific and evidence-based interventions. The most important step in functional nutrition is gaining a comprehensive understanding of the client. To that end, I'll meet with each client to assess their individual situation through completion of a thorough client history that assesses their current and previous diet and lifestyle, family history, and potential toxic exposures. Depending on the intake, I may also advise additional specialty testing and an elimination diet. A diet plan and nutritional supplements will be recommended based on the information obtained. This is a multi-step process because it's not one size fits all. One of the most important aspects of the counseling relationship, beyond providing a plan, is education. Although many of my clients have a basic understanding of nutrition, or at a minimum understand that fast foods and processed sweets are unhealthy, eating a healthy diet can be challenging. Since my recommendations may require that the client eat in a way that's new and uncomfortable, building a cooperative relationship is critical to its success. It's also important that clinicians and family members are on board with the plan and to appreciate that the plan's not static and may need to be modified periodically. Why am I the right choice to provide this counseling to your clients? The best advice in the world is only effective if it's followed. Not only am I knowledgeable about nutrition and focused on its role in mental health, I understand from my family's own experience about the importance of meeting an adolescent where they are and validating their experience. As a result, I foster trust and cooperation that allows us to establish an effective therapeutic partnership. Here is my contact information. Please feel free to contact me if you have any questions or if you would like to set up an appointment. Thank you for your time.